Welcome to our presentation, Health and Society: Insights from Global Datasets. This work was developed and presented by Group 3 with contributions from myself, Justin Robinson, Prabhati Sepkota, Cody Stidham, and Mariset Fuoto. Health and society are deeply intertwined, and data gives us the lens to see just how strong that connection really is. When we look at health outcomes across different populations, we begin to notice patterns, how factors like income, education, housing, and even neighborhood design can influence overall well-being. It's not just about individual choices, it's about the environments people live in, the resources they can access, and the opportunities available to them. By analyzing data sets, we can uncover disparities that might otherwise remain hidden. For example, data can reveal how chronic conditions disproportionately affect certain communities or how access to preventative care can dramatically change long-term outcomes. These insights allow us to move beyond assumptions and instead ground our understanding in evidence. Tracking trends over time also helps us anticipate challenges before they become crises. Whether it's monitoring the rise of lifestyle-related illnesses, evaluating the impact of public health campaigns, or studying how environmental factors like pollution affect respiratory health, data provides the foundation for proactive decision-making. Ultimately, the goal is not just to collect numbers, but to translate them into action. Evidence-based decisions informed by data can guide policies, improve healthcare delivery, and support community programs that address real needs. In this way, data becomes more than just information. It becomes a tool for equity, innovation, and healthier societies overall. It is possible to greatly enhance our understanding of health through the use of data. Health data allows us to move beyond surface-level observations and uncover meaningful patterns that might otherwise go unnoticed. By analyzing large and diverse data sets, we can see how different factors such as age, income, education, environment, and lifestyle interact to shape health outcomes. This helps us recognize that health is not determined by biology alone, but it's also deeply influenced by social and environmental conditions. When we connect these insights, we begin to see how social factors like access to nutritious food, safe housing, or quality healthcare services are directly linked to outcomes such as life expectancy, chronic disease rates, and overall well-being. Data makes these connections visible and measurable, which is essential for identifying disparities and addressing inequities in healthcare. Most importantly, health data guides evidence-based decision-making. Instead of relying on assumptions or one-size-fits-all approaches, policymakers, healthcare providers, and community leaders can use data to design targeted interventions that respond to the real needs of specific populations. This ensures that resources are allocated more effectively and that strategies are grounded in evidence rather than guesswork. Ultimately, the use of health data empowers us to make more informed choices in the health field, choices that are supported by evidence, shaped by observation, and aimed at improving outcomes for individuals and communities. In this way, data becomes a powerful tool for advancing not just healthcare, but the overall health of society. Our first data set, the World Health Organization, or WHO, provides data sets that track key global health indicators, things like life expectancy, disease rates, and maternal mortality. These numbers give us the ability to compare health outcomes across different countries and regions. By looking at this data, we can start to see important patterns. For example, we can identify which countries are struggling with lower life expectancy, higher maternal mortality, or greater rates of disease. Once we notice these patterns, it becomes much easier to understand where resources and support are needed most. The real value of this information is that it helps guide smarter evidence-based decisions. Instead of guessing, leaders and organizations can use the data like before to target interventions that will have the greatest impact. In the end, this kind of analysis doesn't just improve healthcare systems, it helps again raise the overall quality of life for people around the world. Our second data set, the U.S. Centers for Disease Control and Prevention runs a program called the Behavioral Risk Factors Surveillance System, or BRFSS. This is one of the largest ongoing health surveys in the world, and it collects information on health behaviors and risk factors, things like smoking, obesity, physical activity, and mental health. What makes this data set so valuable is that it allows us to see how lifestyle choices and risk factors influence health outcomes across different states and populations. By analyzing the data, we can identify which areas of the country are struggling the most with specific issues. For example, if one state shows high rates of smoking but relatively low levels of obesity, public health leaders can focus their efforts on anti-smoking campaigns in that state. Meanwhile, another state might need more resources directed towards tackling obesity or improving mental health support. Our third data set, the World Bank's Health, Nutrition, and Population data set, often called the HNP dataset, provides a wide range of global health and development indicators. It focuses on critical measures such as child mortality, access to healthcare, and vaccination rates, with particular attention to low and middle income countries. This dataset is especially valuable because it allows us to identify where the greatest challenges exist. For example, by tracking vaccination rates, we can see which countries are falling behind and design targeted campaigns to improve coverage. Similarly, monitoring child mortality and healthcare access helps highlight regions where additional resources and support are urgently needed. The ultimate goal of using this data is to guide action that directly improves people's lives. By pinpointing the areas most in need, policymakers, organizations, and global health leaders can focus their efforts where they're going to be the most effective. In doing so, the H&P dataset becomes more than just numbers. It becomes a tool for saving lives and, again, raising the overall quality of life in the countries that need it the most.
Hello, my name is Cody Stidham, and moving on to modeling health data. Health data includes entities that are the subjects of health data, like individuals and countries. Attributes describe characteristics like age and behaviors. Using entities and attributes, we can form relationships that can be used to find solutions. For example, a relationship that we could form would be that smoking leads to an increased chance of lung disease. We can then try to find solutions that would help solve this problem. We can also find positive relationships and find ways to increase their effectiveness. An example of this would be that the more access someone has to healthcare, the longer their life expectancy is, so we can find ways to make healthcare more cost effective so more people have better access to it. Through analyzing data, we can form questions that will provide insight to our health and can help form new ways to improve it. For example, some questions we could form are: how do lifestyle behaviors like diet, exercise, or smoking affect health outcomes? Are there differences in healthcare access across regions or countries? What patterns link income, education, and health outcomes? How do vaccination rates impact child mortality across countries? By asking these questions, we can focus our research and look at data to find any potential patterns, then use those findings to form solutions that can help solve the problems that people are facing. Some insights for health and society are that we are able to find patterns that would otherwise be invisible to us. We can change the scope of the dataset in order to help analyze how to solve a problem in a specific area or on a global scale. Data connects social factors with measurable health outcomes. Lastly, we are able to gather evidence to help formulate plans and create effective policies that will improve our society's health overall. The key takeaways of this showcase are that WHO Global Health Observatory enables cross-country comparisons of health indicators. CDC BRFSS provides detailed insights into state-level health behaviors and risk factors. World Bank (HMP) focuses on low and middle income countries, offering data for equity-driven analysis. Together, these data sets offer complementary perspectives, connecting health outcomes to behaviors, access, and social conditions across diverse populations. WHO, CDC, and World Bank datasets each offer unique insights. In conclusion, by exploring data sets, analysis can understand the link between health and society, uncover trends, and ask meaningful questions. Through data storytelling, we can share insights that help communities and policymakers make informed decisions. Here are our references for this showcase. Thank you for watching, and we hope this was educational to you.